Patients should be at the centre of everything we do. I know in the Francis report a few years ago, it was very important that patients were at the centre, and that one of the stock phrases was "no decision about me without me." And I think that's really important. I think it's really important to involve patients to ensure that we get the right services in the right place at the right time that befits or is in sync with local people's needs and health needs. And it's also a legal requirement of the CCGs to involve and consult with patients. I think we're wanting to work as extensively as we possibly can to involve as many people and many people in society as much as we can through the Local Equality Advisory Forum that looks at protected groups in our society, to go out and seek the most vulnerable people in society and look that we're catering for their needs, for example, with the homeless and people on what is often deemed as the periphery of society, to make sure that services are effective for them too. I think it's about reaching out in lots of different types of media, both print-based media, social media, face-to-face, word of mouth, whatever mechanism we can to involve and engage with people. We have the Patient Congress, which works at a more strategic level that reflects, through recruitment purposes, people from across a multifaceted part of society to get their views. The patient participation groups in each of the GP surgeries to make sure that they're engaged with what's going on and how their health provision can be improved. After all, they're the patients, and often they know what's working and not working in the health service and also in social care services. So it's important to hear that voice coming through. And also, more recently, we've done a citizens' jury on access to mental health services, access to adult mental health services. And again, we went out and we were far-reaching in knowing that people would not necessarily come to us, would not be comfortable in one room. So we actively went out to meet people in their communities, where they lived, where they met, so that we could gain as much of that view as we possibly can. When I go into any meeting, I take the patient with me. As far as I'm concerned, if there's going to be a service change, if there's going to be talks about quality, safety, I put the patient very much in the centre of that decision making. I need to know and touch and feel that these situations are going to be for the benefit of patients.